Preventative health visits play an important role in ensuring every child's good health. These visits help prevent diseases through vaccinations, effectively monitor a child's growth, and give parents the opportunity to ask important questions on how to support their child's health. The first year of a child's life are crucial for their physical, mental, and social development. Today, we discuss important topics related to a child's health and growth with Dr. Salha Abbasi. Dr. Salha Abbasi graduated from Weill Cornell Medicine, Qatar, and currently serves as a pediatric specialist at Sidra Medicine. She is also an active member of the General Pediatric Guidelines Committee and the immunization team in the pediatric division at Sidra Medicine. Dr. Salha Abbasi, welcome. Thank you so much for taking the time to join us.
Thank you.
So today we're going to ask a few very, very important questions, but let's start off by asking you about immunization. A lot of parents have questions around that topic. Tell me, why is it so important and why do we really have to start from day one of a child's life?
So when a baby is in the mother's womb, he is naturally protected by the mother. Once he comes out of the womb, obviously his immunity is very weak. Immunization for us is a way to help him develop an immunity to fight against infections.
And vaccines, are they really necessary throughout a child's life, or does it come to a point where you stop getting vaccines?
So every country has their own vaccine schedule. There are different time points where we vaccinate children. And obviously, once they're out of their childhood, there are no more vaccines apart from a few that we give like lifelong, like, for example, the flu vaccine.
So some vaccines are given in double doses or sometimes even 3 doses, and some are single doses. Why is that really?
So all of this, there's a lot of background research that goes into how many doses and at what time point of the life the child will get the vaccine. So there are several vaccines that 1 dose is enough to provide you lifelong immunity. But a majority of the vaccines, we give them at multiple standpoints so that the body can build a memory against that particular bacteria or virus. And that memory is good enough to last the lifetime of that individual.
Mm-hmm. But we also see vaccines in the schedule, for conditions that are long gone or that aren't so common really. Mm-hmm. Why are they still there?
So the reason that they're still there is because we want them to not come back. Of course, the life expectancy of individuals has increased. Back in the day, several children would die of things that we don't even hear of anymore. And the reason that we're able to eradicate them is because of vaccines for majority of children in a community.
And what would happen if I skip one of the vaccines? Is it a big deal, really?
If, for example, a parent chooses to skip a vaccine, which sometimes does happen in clinics, and all of this is based on some information that a family member told them, or maybe based on their experience on social media, or sometimes even their personal experience, we try to address their concerns. And if, for example, they still do choose, the thing is when you're choosing to skip a vaccine, you're not just choosing to skip a vaccine for the person, it's also the concept that everyone around you, if the baby or the child does catch that infection, he will say a child who is not yet eligible to get the vaccine could potentially catch the infection just because this child has not been vaccinated yet.
And so what happens if, say, I skip a vaccine? How can I make up for it?
We have schedules. We call them catch-up vaccination schedules. So there is a particular time where a child is supposed to get a vaccine, but we see a lot of children, we call them, for example, vaccine defaulters. So they do fall into another different schedule and we vaccinate them accordingly.
So it's not so much bound by time?
It isn't. For us, the primary goal is to vaccinate them timely. If it doesn't happen, we have catch-up schedules for children. So, for example, if a child is very ill, cannot get his vaccine at a particular time, of course, we will rearrange that and we will give them based on a different schedule.
And so you said the vaccines, they differ, the schedules between different countries. Mm-hmm. So how does that work exactly? And are they normally reviewed every few years, or how does it work exactly?
So the vaccine schedule is revised every few years. The Ministry of Public Health releases a new vaccine schedule. And then we see if there's any, as physicians, we do review, every hospital has a department that reviews the changes and makes the adjustments as needed.
Anything else that you want to add? In terms of how has the uptake really been? Do you have a lot of families that really follow that vaccination schedule to the T, or are there any concerns there?
In our clinics, most of the families do follow the vaccine schedules. A lot of families do come in with a lot of concerns, like I've mentioned earlier. There's a lot of information on social media. There's a lot of experiences of family members. So we try to address all of their concerns, but most of our families are able to follow the vaccine schedules appropriately. We have an excellent nursing team that advocates very strongly for vaccines and actually is very proactive in addressing parents' concerns even before the parent comes and sees the physician. I believe that vaccines are very important for children. The decision to vaccinate your child or not vaccinate your child not only affects your child, but it also affects the whole community in general. If you have any concerns, please reach out to any pediatrician, and we're very happy to answer all your questions and queries. Most of these vaccines, when put into the schedule, have been tested. They're safe, they're effective, and we would not give anything to a child that we know is not going to help them in the future.
Can you tell me a bit about the flu vaccine?
So flu vaccine is something that we give to children and adults every year. This vaccine is supposed to protect you against the seasonal flu, which is caused by the influenza virus. This vaccine needs to be repeated every year in order to protect you throughout that flu season. So our flu season typically starts like mid-September and goes all the way up to end of February, beginning of March. And we try to give this vaccine to all children because they are more prone to have a severe infection when they have influenza. There are several studies that say that if you get the vaccine, the symptoms, you might still get the infection, but your symptoms are going to be much milder. So we try to vaccinate as many children as possible.
But this is one of the optional vaccines.
That is correct.
Right. So you basically have the compulsory ones, which are part of the schedule, and then you have some optional ones. So besides the flu vaccine, are there any other optional ones?
Another one that is optional for in Qatar so far is the HPV vaccine, which is the human papilloma virus vaccine. This provides a protection against viruses that are transmitted by sexual contact. We encourage boys and girls more than 11 years of age to take the vaccine to protect them from the future developing cancers that are associated to these viruses.
And do you see a current surge in certain conditions that are preventable via vaccine amongst the children that you see?
We have good vaccination rate in the country, so we do not see that many of these preventable conditions. But to maintain that, I would say that families should continue to vaccinate their children timely.
And if we move on to another topic, breastfeeding, that's an important one. Are there certain conditions where you would recommend that a child is formula fed, for example?
As a pediatrician, we always recommend that the child should be breastfed in the first 6 months of their life. Breastfeeding not only provides you with the complete nutrition that a baby needs at that age, but will also provide you with protection against all of these infections. I mean, leading in from what the discussion we were having about vaccines, when a baby is born, they don't have much strength to fight infections, and the breast milk is giving them the strength to fight the infection. So we always recommend a mother, to the best of her capabilities, to proceed with breastfeeding.
And under what conditions or circumstances, really, would you recommend that a child be put on formula?
No. So we see the child at multiple time points in their life. We have multiple well-child visits. During the visits, we always ask mother what kind of feeding is the baby having. If the mother does say that she's struggling with breastfeeding, we try to address their concerns. We have excellent lactation consultants in the country. There should, unless it's medically not indicated, we always recommend that the baby should be on breastfeeding.
What about if the mother is on certain medication? I mean, is there any kind of medication that would...
So there are some conditions and some medications. If the mother is taking them, she should not be breastfeeding. However, this is addressed during the prenatal visit. So I'd encourage all mothers, if they have any such questions, to either talk to their pediatrician or their obstetrician so that we can devise a plan for her if she cannot breastfeed.
So up to what age would you actually recommend that a child be breastfed?
We recommend that a child should be breastfed at least 6 months of age, and then we will slowly start introducing solids for the child. So when moms come to see us at their 4-month visit and the 6-month visit, we already start talking to them about introducing solids.
And as part of introducing solids, do you also recommend introducing formula?
Not typically. If a mom has enough breast milk and the baby is gaining weight well, then we will just introduce solids and continue breastfeeding for the baby.
Because of course, I mean, continuing to breastfeed, it can be challenging, especially for working mothers. So how do you actually see them balancing that, really?
It's a very difficult job, and we see mothers doing a great job at balancing work and taking care of the baby. A lot of mothers, either they'll pump their breast milk. A lot of companies also offer breastfeeding hours. So they work around those to be able to provide adequate nutrition for their children.
And would you say in terms of, the nutrition, like you said, I mean, formula in comparison to breast milk, there's a huge difference there. You also see that children gain more weight on formula milk. Can we talk a little bit about that?
So anecdotally, I think moms do say that children tend to gain more weight on formula as compared to breastfeeding. But then when we see it in practice, there is not much difference. Maybe it would be something subjective, but if a mom has enough milk supply and the baby is fed adequately, they do gain weight appropriately.
So if we talk about the nutrients that a child gets from breast milk versus formula, would you say there's a huge difference there?
So the companies that create formula milk try to create it as close to breast milk as possible. However, the major difference between the two would be the strength to fight infections, like the passive immunity that the breast milk provides the baby might not be replicated in a formula milk.
And would you say that it's possible for a child, I mean a baby really, to be allergic to a certain formula? Is that possible?
A baby should not be allergic to a formula. However, we do see children that have cow's milk protein allergy and might need a special kind of formula if they are formula fed.
And are there any specific signs that a mother should look out for to know that her child's allergic?
One of the common things would be if they have a skin rash, if they're not very well settled, they don't have proper bowel movements. Those would be concerning signs, and they're not gaining weight adequately. At that time, it would be good to bring your child to a pediatrician, and we will examine them and see what is going on with the baby.
And in terms of actually weaning your child, are there any tips or tricks that you would recommend? I mean, that's of course quite a stressful period for most mothers.
I think it's the most interesting period for most mothers. Most mothers who come to clinic are very excited to start solids. We typically tell them to enjoy it. It's once in a lifetime kind of an opportunity to start introducing one thing at a time, observe the signs, observe feeding cues in the baby, and see what the baby likes and feed that to the baby.
So what kind of health conditions does obesity cause really?
Obesity can affect pretty much any system of the body. We see children having breathing difficulties because of obesity. We see them having issues with their liver because of obesity. We see them having issues with their joints. So obesity is something that affects multi-systems. It's difficult to manage because it's changing the whole lifestyle of a whole family to control that child's weight. It psychologically also impacts a lot of children. There's a lot of bullying associated
and socially,
and socially. Whether they're girls or boys, a lot of them would come to clinic and they have been bullied in school because of their weight. They have difficulty sleeping because they're not able to breathe comfortably because of their weight. And like I said, it's very difficult to manage because you don't have a quick fix for it. There are newer drugs out in the market, but then everything goes hand in hand with lifestyle modification. When we see children in our clinic who are struggling with obesity, it's that we always try to encourage that it shouldn't be just the child who's changing their routine in life. It should be the whole family, because that is the way to actually make sure that this continues, the good habits or the new habits continue for the rest of their lives.
And one hot topic, let's say, that a lot of parents just really struggle with is digital devices. A lot of kids spend a lot of time on, their tablets, playing games. Would you say that is one of the reasons for obesity?
Definitely it is. When you're spending the times on tablet, you're just sitting in a room, you're passively eating things, and most of them would be things that are non-nutritive, but they have a lot of calories in them. Children are not go out in the park and play. That will burn some calories. So I would definitely say, and every time that we see a child in clinic, we try to encourage families to really limit screen time. The maximum allowed screen time would be, say, an hour to 2 hours. And we see children, especially on their vacation, would spend 12 hours on their devices.
And I mean, it's quite difficult for a child to get a child not to, eat their favorite food or, get them off one of these devices. I mean, what tips would you really, put out there for parents?
I think the number one thing is that the family, like the parents, both parents should first implement the change within themselves, because we as adults also have
Lead by example.
Yes. So we have the tendency to like spend a lot of our time on phones. We always have our phone around, or like we're like binge watching things on Netflix. So a parent should first, once they change it within themselves, it naturally kind of like becomes the household routine. So I typically also tell the family, for example, all of you, once you're back from work and the children are back from school, everybody goes out for a walk for 45 minutes. Like right now, the weather outside is pleasant. Just a walk around the park, 45 minutes, it's good enough for you to at least have some activity in the day. Make sure that your children are registered in some kind of sports. So say it is football, say they like basketball, so that way you're incorporating some activity in their life instead of them spending their time passively on their phone. Reading is something we always encourage. The family sits together, reads a book. I think that's a good opportunity for family bonding as well. And then you can, while you're doing that, incorporate new things in your life.
I mean, obesity is such a loose term. How do you even label a child as obese? I mean, is there a specific weight and age that you kind of match up? How does it work exactly?
We get a lot of referrals for children who have obesity. We check their weight and then we check their height. Based on their age and height, we calculate their BMIs, and then the BMI stratifies them onto whether they're overweight, whether they're obese, and which class of obesity do they have. The management obviously will differ, because what conditions they have associated with their obesity will differ on how severe their obesity is. But I think the key thing for families would always be the lifestyle changes that they should implement for not just that one child, but also the whole family in general.
And so you've talked about the importance of, parents, really in this equation. What about, other people that are important in a child's life? I mean, schools, maybe clubs that they're part of. How can they really influence a child's lifetime? What's the role of a school?
I think the schools are doing a great job. And they have a very major role in this. Depends upon what kind of food is available in your cafeteria, for example. Making sure that children are making those healthy choices is also about availability. So if they have access to healthy food, they will tend to choose that healthy food. The other thing would be having like a physical activity period where all children are doing some sort of an activity during the day. Having a health and nutrition class, for example, would be helpful for children. And I'm sure that it's already a part of the curriculum in majority of the schools, where they do talk about healthy lifestyle habits that would potentially prevent obesity and all other diseases that are associated to it.
And do you see any shift? I mean, this is a big problem, obesity, as you pointed out. I mean, do you see a shift in terms of the focus? Is everything all about, tackling obesity nowadays?
I think there is much more awareness amongst parents, both mothers and fathers. We have a lot of parents coming in proactively, even when their child is not necessarily obese yet, but just like a little overweight. They are coming actively seeking for advice so that they don't lead into, say, obesity. A lot of children who are obese have parents who have at some point of their life been obese. So they do recognize those things earlier and they come back. I think definitely parents are more aware, and I'm sure social media played a huge role in that. And awareness makes them seek help earlier. So we're able to start tackling the problem much earlier because of all this awareness.
But would you say it all comes down to lifestyle? What about genetics?
So genetics does play a significant role in obesity. And every time we do see a child in clinic who has obesity, we take a very extensive family history. If we have high suspicion that this child could potentially have a significant genetic background, we do refer to our colleagues in either genetics department or endocrinology department. The more common obesity is the one that is multifactorial. So it's maybe there is a genetic component, but it's more lifestyle. Lifestyle plays an even bigger role in it. So regardless, what we're supposed to tackle is the lifestyle modifications.
What would your advice be to parents that are going through exactly that?
To be honest, a parent, the moment that a family decides that they want to have a child, is that moment where you just sit back and think, like, is your
compatible.
lifestyle, yeah, not just also compatible, but also in the sense, like, is this what you want your child's lifestyle to be like as well? Because your child will do whatever he sees around him. So there's a lot of research also in this area that if the mother's lifestyle is what the child's lifestyle will be in the end. So if mom is choosing healthy foods, or mom is choosing to be active during her pregnancy, after after having the baby, then the child will obviously adapt those kind of lifestyles as well. So I think the first thing is to like just fix, if you think that you have unhealthy eating habits, if you think that you are this person who's not necessarily very active, first fix that, and that will help you adjust your child's lifestyle as well. We always say when you go grocery shopping, don't bring snacks, don't bring fizzy drinks.
That's the hard one, right?
That's the hard one. And of course, it's very difficult for a parent to say no to a child's wish. However, like,
and they do it out of love. And love should be
yes,
the other way.
But too much love is also not a very good thing. So,
so if we talk about nutrition for a breastfeeding mother, what really should she be eating?
There is no particular food. If you're talking about in terms of some foods that increases breast milk, there's no particular food that necessarily increases your breast milk. I think a healthy balanced diet with good amount of protein, carbohydrates, healthy fats, and plenty of hydration would be adequate for a mother to be able to have enough breast milk to feed the baby.
And you often hear, things that you don't know whether it's myth or reality. I mean, certain foods that a new mother should be avoiding. So are there any foods that she should be avoiding?
Not to my knowledge. So there should be nothing that a mother should be avoiding.
It's not like pineapples out or anything like that?
Not necessarily. I think whatever a mom likes, she eats it. And the most important thing is good hydration and healthy choices. And that should be good enough for the mom.
And are there any additional supplements that you would recommend a mother takes?
There is no additional supplements that she would need. Typically, after the baby is born, an obstetrician meets the mother and sees if she has any deficiencies, and based on that, she should take any replacement if needed. Apart from that, our diet should have all the nutrients that we need to be able to breastfeed adequately.
Mm-hmm. And are there any special, let's say, situations where a child that is being breastfed is not receiving enough nutrients?
One of the ways that when we talk to moms is like, if your baby is adequately breastfeeding, he will, after the feed is over, the baby will be asleep. You will see a good number of wet diapers. When you come to the well baby visits, which is every 2 months in the beginning of their life, they'll be gaining weight adequately. It will be a happy, joyful baby. That would all be signs that the baby is well fed. Of course, if there are any concerns that moms think that they are not happy with how much the baby is taking, that's a good time to book an appointment with your pediatrician so that we can sit and talk about it, examine the child, see how much weight the baby is gaining, and then manage accordingly.
And what are these well baby visits that you were mentioning?
Any baby that is born, we see them at periodic intervals to make sure that the mother, the baby, and the family is actually doing well. So these are extensive visits where we go through everything with the mother. How is the baby's feeding? How's the baby's sleep? If there's any vaccines due, we give it to the baby. We give them anticipatory guidance until they see us the next time. So typically we see the child at around 5 days of age. Then when the baby is 1 month, 2 months, 4 months, and so on.
And this kind of goes hand in hand with checkups with the mother.
Exactly. So a lot of times moms will come raising some concerns with us, and then we refer them to appropriate facilities so that those can be concerned. Obviously, we are pediatricians. Our primary focus is a baby, but healthy mother is important to us as well. So we also try to focus on anything that we can help the mom with, and then we will arrange for that.
And do you find like a big uptake, really? I mean, do a lot of mothers or, new parents come seeking that kind of advice?
Okay. So yes, we always run full clinics, and most of them are these families who are seeking advice regarding a new baby in the family and addressing different questions about like feeding, about vaccinations, about any other medical concerns that the baby has.
And what would you say are the most common concerns?
The most common concerns is usually feeding related. So is my baby gaining enough weight? At around 2 months of age, moms will come in complaining that he's not sleeping through the night, maybe, is a bit colicky. A lot of it is us just providing them reassurance and tackling any little problems that they have day to day.
And would you say second-time moms are more relaxed then?
It depends. But yes, definitely second times moms are more relaxed.
It would be great if we can talk a bit about the vaccine schedule. I mean, there's so many vaccines. How many are there actually?
So the Qatar vaccination schedule has around 15 vaccines. We see children at different time points and we vaccinate them. Those 15 vaccines, some of them are given at multiple points.
And so we start from day one
Mm-hmm.
and we end...
So it depends upon the child, but typically we start from day one. At birth, most of our children get 2 vaccines. One of them is the BCG vaccine and the other one is the hepatitis B vaccine. Typically, if a baby is fit to get a hepatitis B vaccine, they'll get 1 shot right at birth. This protects you against the hepatitis B virus, which is one of the common causes of liver issues later on during the life of the child. We give the hepatitis B vaccines multiple doses at different point of their life, and that provides us adequate immunity to hopefully the child not having any infection or any infection causing it to affect his liver during his life.
Because there's so many vaccines on there. I think that most parents might be a bit confused in terms of what the benefit of each one is. Are there any other key ones that you could mention? What about polio?
There are 2 types of polio vaccines. There are injections, and there is the injectable ones, and there is the oral drops, So there are the oral drops and there are the injectable ones. They are given at different time points. We give both of them. Our vaccine schedule has a mix of both of them. Typically, we know that polio has been eradicated from majority of the countries in the world, but we need to make sure that our children stay safe. It's a very serious disease and it has very devastating implications on a child if a child is not vaccinated. There are not much side effects of the oral polio. Of course, injectable ones, we typically tell the mothers that we are expecting that the area will be a bit red, swollen, the baby might be a bit uncomfortable.
And what would you say are some of the common side effects of vaccines?
So the most common side effects of vaccine would be fever. After the vaccine, maybe a day or so, low grade fever that the child might have. Some babies obviously will have redness, a bit of swelling at the site of the injection. They can also complain of pain. They'll be a bit fussy that day. So we try to tell moms that that's a big day in the child's life. Give him some Panadol, let them settle down, a lot of comfort, a lot of cuddling, and the day will pass. It's just very important for the child to actually get that vaccine that day.
And why? Why is that the reaction?
So it is because we're introducing a foreign substance. Part of the body responding to the vaccine is that there will be some inflammation on the site. And it's basically telling us that the body is showing response. And then
so that's a good thing.
It's a good thing, yes.
Mm-hmm.
And it's something that we can very easily also manage. Lots of cuddling, lots of good frequent feeding, a bit of Panadol if needed. And then the baby typically does well.
So we can't really avoid it. It's a good thing.
Yes, it's a good thing. It's something that we can manage. And obviously, whenever we give vaccines to mother, we tell them that if there are any concerns, they can give us a call back in the clinic and we will arrange for them to be seen.
Is it possible to have any reaction to some of the vaccines that are out of the ordinary?
Some children will develop some reaction. So typically in clinics, if we give them vaccines, we do observe them for 15 minutes after the vaccine dose is given. However, majority of children will not have any reactions. The ones that have reactions, we can medically manage them. For example, if someone develops a rash after the vaccine, we'll give them some medicine to let the rash settle. That would be the most typical outcome. If, for example, a baby did react to a vaccine in the past, then if he's getting the next dose, we have to be more vigilant about it, about when to give it and whether we have to still give it or not.
And do you ever have situations, I'm thinking out loud, but do you ever have situations where for a specific child you would not give one of the vaccines in the schedule?
Okay. Yes, so there are situations where we would not give the vaccine to the child. Of course, most of them would be if the child himself or herself has any difficulties with immunity, if there's any significant family history that is withholding us from giving vaccines. These children, then we do an extensive evaluation, and based on that, we'll give them vaccines at a later time.
Can we talk a bit about supplements? During breastfeeding, for both the mother and the child, really, are there any necessary supplements?
The only supplement that we recommend the baby to take in the first 6 months of life is vitamin D drops. We tell the baby has to take vitamin D drops every day. Whenever the mother remembers, she gives the baby the vitamin D drops. Apart from that, it's also good for the mother to go check her vitamin D levels. And if she has any deficiency, she should be taking vitamin D supplementation.
I hear so much about vitamin D. Why?
I think it's a lot to do with the fact that we do spend most of our times indoors. Like, we have lovely sunshine in Qatar for a lot of the months, but then we also spend most of our times indoors. People wear like fully covered clothes, so there's not much exposure to the sun, and that most likely is contributing to vitamin D deficiencies in the region.
And you say during the first 6 months of life. I mean, there are a lot of children that continue, up to the age of 18. Is it still necessary after 6 months?
So first 6 months, because the baby is exclusively breastfed, we highly recommend that the baby should be taking vitamin D. Of course, after that depends on a case-to-case basis, but a lot of our solid foods sometimes will have some vitamin D added to them. So we would say continue it, and then at 1 year of age, we will check the blood test of the baby, and at that point we do check a vitamin D level and see whether the child needs additional supplementation or doesn't need any supplementation.
And how regular would you recommend these checkups happen?
When a baby is born, we see them very frequently, but once they're older, like out of their toddler age, we try to see them annually. Regarding blood investigations, it always depends upon the child's condition. Typically at birth, we do see if there is any anemia, which is like any low hemoglobin, because we want to supplement them with iron, whether it's needed or not. So that we typically do at 1 year of age. And after that, it all depends upon the child's condition. How balanced is the baby's diet? If there is any other medical condition going on, that will prompt us to do investigations for them.
So there needs to be some prompt, really. So you wouldn't recommend, I don't know, I'm thinking out loud again, every 3 years, a full checkup for a child, including blood investigations.
So a full checkup of the child, I think every child should at least be seen annually. After that, they're a toddler, after toddler age, they should be seen at least annually, which involves us taking their weight, their height, all the other vital signs, doing an extensive physical examination, taking a history, and then that will make us decide whether or not they need blood investigations or not.
We talked quite a bit about obesity in childhood. What about, the complete opposite direction, eating disorders? Can you talk a bit about that?
So just like obesity, eating disorders is something that is very difficult to manage. We have noticed that parents are very aware about the condition now, and we are seeing parents bringing their children when they are concerned about their eating habits. Just like obesity, I think social media has played a very significant role into how prevalent eating disorder is at the time. We have a specialized department that deals with children who come in with eating disorders. We see them in our clinics, and then we refer to them, and then they have a very a multidisciplinary team approach towards them. It is something that is difficult to manage, but we have seen children do wonderfully once they have achieved the appropriate care that they need.
And so you say a multidisciplinary approach. What different aspects are we talking about?
So usually these teams involve a physician, we'll have a psychiatrist on board, you'll have a dietitian with you, a social worker, and they will devise a plan for the child based on what are the things that are active. And a lot of times, the whole family dynamic, like the family also plays a part of this team, because you want the siblings, the parents, all of them to be on board to devise a plan for that child. And
also create that support system.
Of course, yes.
And so if we're looking, we've got obesity, we've got, eating disorders. Is there some kind of nutritional plan for a child, even that age? We often look at these elaborate nutrition plans for adults. What about children? Is something available?
We always say home-cooked meals are the best thing for the child. So 3 meals a day at fixed times, 2 snacks in between, good amount of water, and make sure that everything that your child is taking is something that is healthy, is nutritious for the child. So, for example, a lot of times you would see that the snack would be like biscuits with tea.
The reward.
Yes, with the reward. Or like it's a bar of candy. Instead of that, we should be thinking about say, berries with yogurt. We always tell our parents that's such a complete meal. Like, you're giving fiber, you're giving protein, you're giving healthy fats. to the child. So every time you're serving something to the child, as long as you're providing them a balanced meal with all components that are needed, that should be what is required for the child. I don't think you need any of those elaborate plans, just home cooked meals and at fixed intervals and in an appropriate quantity.
Of course, 'cause, I mean, you see a lot of parents, rewarding their children with, a lot of sugary food or pizza or these kind of things. So I guess that's out of the window.
It should be. So again, rewards should be always for children, like in terms of their growth. Positive reinforcement is a good idea, but the positive reinforcement doesn't necessarily have to come with like me taking them to like KFC for a cheat day. Instead, it should be like a day out in the park or like a swimming day. So
more active.
And if, for example, we are talking, and if it is like related to a meal, it should be something that is nutritious, not necessarily like just calorie dense in general.
So we use vaccines really to protect us from certain diseases, let's say. But can any of them cause another disease that they weren't intended for in a way?
Not that I am aware of. Typically, vaccines are safe. They have gone through a rigorous process after which they are approved to be used in our children. Again, I cannot emphasize enough how important it is to make sure that your child gets all his childhood vaccinations, not only to protect the child itself, but to protect the whole community.
So today you've given us some, amazing information. I think that a lot of parents would be thankful for. We've touched on vaccinations, breastfeeding, obesity, and other topics in between. What advice would you give, mothers or parents really in general?
I think mothers do a great job. It's a difficult job. A lot of women are balancing house, work, a career. So whatever you're doing an excellent job. Don't forget that there's support there out there for you. So seek help wherever you can. Whenever you come to see a pediatrician, ask us your concerns and aim towards a balanced life. It's always easier said than done, but make sure that your diet, your lifestyle, your activity level, whatever passive media that you're consuming, it's all in a way that's aligned towards a healthier lifestyle.
Any final thoughts, really? Any advice you would actually give the children themselves? I mean, we're of course giving a lot of advice to parents, but what about the kids? What role do they have to play in this?
Kids mirror our actions as adults. So I think look for positive role models in your life. Think of changes depending obviously upon their age and understanding, but especially teenagers, for example. Think of where you want to see yourself 10 years down the road. We see a lot of children now, they're very self-aware. They understand the implications of their actions. So making adjustments based on how you want your future to look like would be an excellent idea. And then speak to your pediatrician. We are always happy to address any concerns that you have.
Thank you so much, Dr. Abbasi, for sharing all your insights with us today and helping us really, look after our children's health. Thank you. Find out more, listen to the Sehatuha podcast on all major platforms.